people like G. Edward Griffin early on, back in the 1980s, was talking about HIV and what it could and could not be. And so obviously there's something that they're scaling. There's some kind of illness that they're scaling, but not necessarily an actual virus or anything like that. But people are obviously getting sick. So is HIV vaccine related? Is it an injury? Is it too many toxins in people's diet? What is HIV?
Right. Well, let's clarify that, HIV is the name of the virus that really doesn't exist. Right. AIDS, the actual, constellation of symptoms, of course, is real. But in fact, the conditions that qualify you for AIDS didn't suddenly come about during the AIDS epidemic. They have existed and been known in many books before that. For example, several years before the AIDS issue came about, people were successfully getting kidney transplants for the first time because of a new transplant rejection medicine called azathioprine. Now, this caused them to have things like Kaposi sarcoma, right, which is known as the gay cancer. But these were people who had kidney transplants. It had nothing to do with AIDS or HIV. So what brought about an expansion of AIDS at that time was a number of different factors, and it was different in different geographic areas and among different populations. So, for example, in like Northern California, among the homosexual population, there was a lot of decadent and self-destructive behavior, especially a lot of drug abuse, including intravenous drug abuse, which puts foreign substances in the body and already stresses your immune system, which deals with foreign substances entering your body, like when you get a cut. And they were taking prophylactic antibiotics like Bactrim, which is chemically related to azathioprine and can cause similar immune suppression. And they were also using something called skin poppers, which is also known as amyl nitrate. And that was supposed to enhance sexual functioning, but also is immunosuppressive and somewhat related to azathioprine. So it was a combination of the lifestyle, an extreme number of sexual partners, and the drugs and the preventive things that I told you about all added up to a sickness. And then, of course, we know that when they started treating them, it got much worse because they took an old drug that was developed for cancer that was too poisonous to be used and just said, oh, we'll use it now. And of course, it actually killed many of the people.
Right. So I've never seen a single person that claimed they had HIV or AIDS that wasn't heavily vaccinated. I've done a lot of research into this. I think there appears to be a 100% rate of vaccines among people who say they have this illness. Now, it seems so significant that we're now moving into another propaganda campaign. A lot of people are asking, is the other one collapsing? Is the narrative collapsing so much that they have to move on to something else? Can it even be, can people even fall for this? I mean, I shouldn't ask that. Everyone knows that people will fall for whatever is thrown at them these days, obviously. But why would they come out with this campaign now of all times when they have the collapse of the vaccine propaganda as people are waking up, obviously, in huge numbers to it?
Right. Well, I want to clarify something you said before about the vaccines, because that we have to differentiate once again between the HIV and the AIDS, right? Because the people, first of all, there's almost no one who has AIDS now. It's practically gone. The HIV positive people is just a test. They're not actually sick. And it's been shown that over 60 different conditions give you a false positive HIV test. That's another test that's actually never been FDA approved. And several of those conditions include vaccines. So if you take like a flu shot or a hepatitis B vaccine, that can give you a positive HIV test. And in fact, in Australia, there was a clinical trial with a vaccine candidate for COVID that also a bunch of the people in the trial converted to a positive HIV test. And so I think that might have made the product fail the study. I'm not sure exactly what happened. So those antibody tests are not specific at all for HIV. So many things can make them positive, and people might believe that means that they could get sick, but really it's just a meaningless test result.